A campaign meant to raise awareness and advocate for deaf, hard of hearing, and deaf-blind people is getting bigger. The woman you just saw is award-winning actress Marlee Matlin. She teamed up with the Connecticut Hospital Association and the American School for the Deaf to create a training video for our state's hospitals. This is all part of a wider initiative called Lost in Translation. I sat down with the school and the Hospital Association earlier today to talk about this initiative. Here to tell us more about the initiative, our American School for the Deaf's Executive Director, Jeff Braven, his interpreter, Heidi, and the CT Hospital Association's Director of Regulatory Advocacy, Muriel Daniels. Thank you all so much for being here this afternoon. So, first question for you, what is the Lost in Translation campaign trying to accomplish?
So this campaign is a collaborative effort with the state of Connecticut through the American Rescue Act, and the purpose of this was to receive funds to help the deaf, hard of hearing, and deaf-blind community to raise awareness around how to be able to deal with deaf people, deaf-blind people, or hard of hearing people in medical and healthcare settings.
And communication obviously is a barrier for so many people in certain situations. So what have some deaf and hard of hearing patients experienced in hospitals when it comes to communication? How has it affected their care?
So as you know, not every deaf individual is the same. They are all individuals, and so sometimes people think there's only one way to communicate with a deaf, hard of hearing, or deaf-blind person, but that's not true. Some prefer to write back and forth. Some prefer to have a live interpreter like I do today. Some prefer to lip read, so we have clear masks for that purpose, and so we really want to raise awareness around the different perspectives and communication modalities so people realize it's not a one-size-fits-all. Ultimately, you have to ask the patient what is best for you and then work with the patient from there.
And I would say from the healthcare side, we have to, of course, accommodate each patient and take in their individual needs, but we have to work with the resources we have. We can't always get live interpreters. There is not always an availability of them. We often have to rely on some other aids, and that can impact the person's experience from the patient perspective. If they have their live interpreter for the whole experience, it can go really well. If you're using video, there are, differences in that experience. So we've heard from the community some of the challenges they've faced, and we've continued to try to work with stakeholders like the American School for the Deaf to, kind of bridge those gaps.
And having the tools you need to is very important. Jeff just mentioned the clear masks, because some people have to lip read. So that leads me to my next question here. How does this new training video add to the campaign?
Well, I know for us, it's just a wonderful tool to add to what hospitals were already doing. It's a beautiful, easy way to slot something into your new employee orientation, or if you're bringing on new staff, or if you're retraining on your own policies and procedures, you can just slot this right in. And we worked very closely with Jeff and his folks at the American School for the Deaf to talk to the hospitals, get their feedback, and in this video we've really covered all the areas that came up in those conversations, and I just think it's a great one-stop shop for that, for all the healthcare employees to really get a brief primer on all they need to know when they're going to work with a patient from this individual community.
I also want to mention that CHA has been a tremendous partner with our school. They have access to all of the hospitals, and by that partnership, we are able to include communities such as the deaf, hard of hearing, and deaf-blind community to get their feedback and their input about how they want to be included in this video, because obviously the training video cannot be too long, but we have a little bit of time to be able to cover all the important points. And so we also want to talk about the doctors and the nurses' perspective, bring that all together so we can provide a video that can really address how to deal with these kinds of patients.
Yeah, to Jeff's point, it's not just for hospitals. This video is for really any provider in healthcare. I think anything in the training video covered something that a doctor's office could also utilize. So it's really bridging, not just beyond the hospitals, but any provider.
Thank you both so much this afternoon for providing your insight. Jeff, thank you again. You've been to our studio several times. You're an expert in this area. Thank you so much again.
Thank you so much for having us, and thank you also for continuing to help us raise the awareness. We appreciate it.
Absolutely.